Hello, it's day one officially of the Seattle study tour, and I'm talking to you from the Space Needle, where the group will be arriving shortly to do the next part of the leadership program following on from their visit to Harborview today. Harborview, as we talked about yesterday, is the largest only designated Category 1 trauma center in Seattle. It is the place that if the president was visiting Seattle, he would be admitted over and above any other hospital. Interestingly, both Virginia Mason and Harborview Medical Center share the leapfrog rating of grade A, which something the group learned about today. And it's very interesting to watch the questions that were driving the group. Clearly their mind is on regulation and targets and wondering how it works in America, finding to their surprise that there is a league table. There are quality standards that leaders here have to aspire to. I think another insight that came from the visit to Harborview this morning was around the lengths that they're going to engage physicians in leadership and to hold physicians to account for things such as communication. And so there was an interesting matrix that was shared today where there are 5 questions that patients are asked, starting with, were you treated with respect? Were you listened to, and did you understand what you were told? In other words, were they communicated with well? This was hugely interesting for the groups. And questions that came from our cohort included what incentives are in the system to encourage doctors to motivate them to take part and to do communication well. And the answer that came back was, we expect them to do that. That's part of the culture that we're trying to drive here. I think the other area that was of significant interest to the group today was around Harborview Medical Center's move as part of the Accountable Care Network here in Seattle, and how they're having to collaborate with other competitors and kind of a whole system approach, as we would call it in the UK, towards achieving accountable care organizations network. One of the big incentives that's driving this is that Boeing and Amazon, huge employers in the region, will probably find it much more attractive to buy an accountable care network plan. And for users, purchases of the plan, so if I were the patient, it's less expensive than another plan. So there's lots of incentives in the system to move towards this, but it's not without its issues. There's still competition. Some of the competitors to Harborview, for example, may want to hang on to their trauma cases because trauma equals money, it's high value work. And Harborview see more than 6,000 trauma cases per year, so that would have an impact on them. The group also heard about it's a drive from volume to value. That's echoing very much the work that we're looking at in the UK, and how this is the burning platform. In terms of achieving the triple aim, they have to go beyond high quality and lower cost. And one of the acknowledged issues in the system today was on the resilience issue for leaders in healthcare. How will they retain the resilience?